Hi, everybody. This is April, and it is Sunday, and we're about to start week 4. So, um, I was out of town visiting my daughter for her birthday, but I have been reading emails, and it is concerning to me that you're very worried about your soap notes. And I want you to relax because this is a learning process, and I know other people may have had different expectations. I've heard that they expected it to be in a specific order, or it could only be one page. Well, in my opinion, soap notes are a story, and that story is telling me about your patient encounter. And it's very important that you have the necessary pieces of the soap note there, but it's also very important that you be able to tell the story. So, let me tell you why soap notes are so important, because there are a couple of reasons. Number one, soap notes are important because we need to justify our billing. Now, when you are coding your charts at, say, 99212, 99213, you may see sometimes I'll make a notation on there that says, that seems like an awfully high code. And the reason I say that is because your documentation needs to justify that code. Because if you have not documented enough, the insurance company may come in and say, we're not going to pay for that visit. It's not justified. Also, as healthcare providers, we are periodically subject to chart audits by government agencies, Medicare, Medicaid, to ensure that we are not upcoding. And what that means is billing at a higher rate than we should for the care that we've provided to our patients. So there are certain components of the chart that need to be present in order for you to justify documenting it at a 99215, for example. And we don't want to undercode, we don't want to overcode. If a patient has insurance, we're charging that insurance company a rate that we shouldn't, and that's against the law. If the patient is paying out of pocket, we're making that patient pay at a higher rate than perhaps they can even afford. So, for an example, and this is just arbitrary, it depends on your practice. I'm charging someone at a rate at a 99213. That visit may cost $89. A 99214 might be $110. A 99215 might be $200. So the fee is directly associated to the code. So if it's appropriate, not a problem. I want you to document and bill appropriately. But if it isn't, then we could get in trouble. Another thing is it is important to have all of the components present so that you are justifying your diagnosis. And with charting, it's very important. You're telling a story. You're telling a story about the encounter that you've had with your patient. And you're also documenting what led you to come to the decision that you've made on that particular patient. Um, and we have to be mindful of the fact that sometimes these charts come back to us as legal cases. So you want to have things documented that are important. For example, if I have a patient that I've instructed to do something and they have told me that they're not going to do it, I'm going to document. Patient was instructed to do this. Patient verbalizes that they will not do this. That's just protecting yourself. Um, so, SOAP note charting also helps us to um, come to our diagnosis, and I'm um, requesting that everyone have 3 to 5 differential diagnoses on their patient charts. And it's important because you don't want the patient coming back to you in a week and saying, you didn't know what you were doing. because we use differential diagnoses. And I'll use skin as an example. Skin is one of the most difficult issues to diagnose. So I have open communication with my patients, and I tell them that I listen to the story that you've told me, and I look at the rash that you have, and then I take that with all of my knowledge that I have and come to what my conclusion is, what I believe this to be. However, we're not always right. So from looking at what I am seeing, I believe this to be a fungal infection. And so I will explain that to the patient. However, skin things can be difficult to diagnose, and if it does not respond to treatment within 3 to 5 days, I want you to come back in, and then we will go back to the drawing board and see if we can come to a better conclusion. Documenting those differential diagnoses in your SOAP note is justification for that, and it's important to have, even in our women's health population. So I thought I would go over a SOAP note and some of the components so that we can come to a conclusion to lower your anxiety. All right. So I'm going to write on this. This is a screenshot of this particular patient, but it's not going to let me see the whole thing. So I don't want this. So I'm going to get rid of this one and go to this one, which will let me do that. Okay. So we can see here this particular patient with the S. The S is our subjective. And our SOAP note charting always starts with the CC. The CC is the chief complaint, and that chief complaint are 1 or 2 words or so that describe why the patient has come to the visit today. It could be something as simple as 36-week prenatal check. It could be annual gynae exam. It could be burning with urination. But I want to know why they're there, and it works well when it's in the patient's words also. Another thing I want to add with your SOAP notes is everybody is allowed to submit one normal SOAP note. That's the patient that came in for an annual gynae check with nothing wrong, or the patient who came in for a 32-week prenatal check, nothing's wrong, but that's it. The rest have to be cases that are atypical. So the patient's come in with a UTI, or the patient has come in with an STI, something else. It can't be normal. Once you've had your one, you can't use it again. Okay. HPI, history of present illness. And that's what I want to know. I want to know what the history is of the present illness. So the CC directly determines what your HPI is going to be. And you can see with this particular patient what she has written her little story here. But it all goes back to the CC. Um, and I had said on some of your SOAP notes that you had put information in there that belonged in the review of systems. So it's okay to add stuff on here in your SOAP note, in your HPI, if it's related to the CC. But if it's not related to that CC, it belongs in your review of systems. Now, in this particular chart, we have her OB/GYN history. And this is imperative. This is women's health. You've got to have a clear understanding of what this patient's OB/GYN history is. And this is part of the S section. General medical history. So what has the patient had any chronic health conditions in the past? Hospitalizations, surgical procedures, medications that they're on, allergies to medication, family medical history, social history. And there's one important piece of information missing from here, from this particular SOAP note, and that's immunization status. So components that have to be in this S section are all those components. Now, it's kind of nice to get into a routine of putting things in a particular order. And some professors expect it to be in a particular order, but in practice, your order is going to be dependent on the electronic medical record that you're working with. For example, now, the electronic medical record that I currently am working with in practice asks for the CC and the HPI first, which is, I think you're going to find that standard in all of them. But after that, it changes a little bit. My previous electronic medical record I worked with wanted medications and allergies, and then it went into the past medical history. The one I'm working with now is different. It wants the past medical history and surgical history, hospitalization. So, whichever order you choose to put it in, that's fine. What works for you? As long as the components are there and it makes some sense, I strongly advise you to develop a template so that you can use that template every time you're writing a SOAP note. Then you know that you have the areas that are required to be put in there in the right sections. Now, let's see. Down here, you see review of systems. This is a really important piece. You've got to have the review of systems, and I had some students submit SOAP notes without one. And it's okay for you to write negative except as documented in the HPI. I'm fine with that. Now, if you want to go through all of the systems and document negative, 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 you can certainly do that, but it's not necessary. Review of systems, negative except as documented in the HPI, that is acceptable to me. Now, we're done with the S portion. We're going to the O. So, objective, what you are seeing. So, with this particular patient, we have vital signs. Vital signs are objective data. And then general information. The patient is a 39-year-old obese female who appears older than her stated age. She is slightly anxious but is pleasant and cooperative. And I want you to go down each area for the O. Now, we're in women's health. So I would find it very um, odd that you didn't have on a patient who was coming with for an annual gynae exam an explanation about what the genitalia looks like, how the speculum exam was done, that her ovaries were not enlarged, that her how what was her muscles like. I mean, you need to document on the exam, and I find that some students fall short with that. Now, let's go on here. The A. We've got our diagnosis here. Now, this one, I wanted to have good and bad in this particular example, fall short. It only has one thing on here. Now, we as healthcare providers and as students especially, you need to have 3 to 5 differential diagnosis for your patient. You also need to include the ICD-10 codes for those patients. Very important. Now we go to the P. What's the plan? What is the treatment? Now, if you are prescribing an, a medication of any kind, you have to write out that prescription. It's not enough to say Z-Pak ordered. No, no. You need to write it out. You would write azithromycin, instructed um, to take 2 tablets today and 2 tablets or 1 tablet a day for the next 4 days, quantity 6 tablets. You have to write the whole thing out. So that would be Zithromax, 250 milligram tablets. Take 2 tablets today. So just as you were writing a prescription, I expect it to be written in your plan. Um, I also expect, so this is what we don't have here. So you've got to write the prescription out here. And education is very important. So, what are you going to teach the patient? And then follow up. When do you want her to come back? Does she need to come back in 3 days, 3 weeks, whatever? Um, so, those components are incredibly important to have in your SOAP note. And It's the bare minimum. If you want to go over and above, that's always fine. You don't have to. I want to ensure that you have the key components present that will um, ensure that you're providing safe care to your patients and you're not overbilling, you're not charging patients, um, but you have a good understanding of what the big picture is. So these are the bare components, and I hope this clarifies things for you a little bit. If you have any other questions or concerns regarding SOAP notes, please don't hesitate to reach out to me because I want you to be successful in this. So um, this is going to be put on the announcement page for everybody to see. All right. Have a good evening.